is Alexander Tirado. I am a physician assistant board certified in aesthetic medicine here in the beautiful sunny Miami, Florida. Today, I would like to talk to you about a very common problem that millions of men suffer in silence when it comes to the insecurity about their look, function, and size of their manhood. We're talking about their penis. For men, this problem increases with age and can dramatically impact upon their sexual performance and confidence. And in the medical field, we call this sexual dysfunction. Another name for it is erectile dysfunction, ED. Well, what is ED? ED, erectile dysfunction, is defined in the medical field as when men have difficulty getting or sustaining an erection long enough to engage in sexual intercourse. You know, we have three types of sexual dysfunction in the medical field. ED for men, for example, desire disorder. This is a lack of sexual desire or interest in sex. Sometimes this is caused by hormonal imbalance or sometimes mental problems. Erectile dysfunction disorder is another one. This is due to a complete inability of a man to have an erection. Sometimes they can have an erection, but it's too soft to have any type of intercourse. They can have an erection sometimes, but they for a short period of time. Another one is orgasm disorder. This is a delay and absence of the climax. Now, what causes ED? Well, most of the cause of ED is due to the choices that we make in lifestyle. For example, the food that we eat, the alcohol, the lack of exercise, the obesity, and many other immune system diseases. And all of this can lead to diabetes, elevated blood pressure, high cholesterol, or obesity. Those are the main causes of erectile dysfunction. Now, there are medical studies that have found that low testosterone level is not significant to cause ED. Even as testosterone level dropped by half between the age of 25 to 75, it is not significant to cause ED. I have patients with testosterone levels maybe like 200 and they are functioning perfectly because they do not have any other diseases. They're very healthy. So that's not a significant problem for ED. Now, if declining testosterone levels are not significant, what is contributing to ED? Well, it has been found that the inability to achieve and maintain an erection is mostly caused by the arteries, which are the vessels that transport oxygen blood from the heart to the body parts. When they become clogged by fat deposit, they eventually get hardened and the tissue becomes calcified completely. This can result in the constriction of the blood flow to the shaft of the penis. Now, what solutions are available? Well, Ricoline has medication that can help you with this. They can correct the blood flow to the penis. For example, men have now medications such as Levitra, Cialis, Viagra, which help with the blood flow to the arteries. But I found that not all men can take this medication and do not want to take the medication due to the side effect of the medication, or one of the main problems is they are very expensive. Another solution is surgery. But again, that's an invasive procedure and not everyone is qualified to have the surgery. We have also injections that cause dilation or expansion of the blood vessels. We have Trimix, we have Bimix. Again, those medications are very helpful, but you have to inject yourself when you're going to have intercourse. However, all of these solutions do not address the cause of ED. It's only a temporary or a band-aid. So now we have a new and remarkable procedure for men called pshot or pshot. The word priapos came from the name of the Greek god of fertility. The procedure was invented and pioneered by Dr. Charles Rono. And what it does, it takes the human factor, the growth factor from within the blood, that is the very same healing factor that causes the wound to heal on your body. These healing factors can be concentrated strategically and placed in the penis and it will cause rejuvenation and healing. The steps of the procedure are very simple. We first apply a numbing cream to the penis, so there's no pain. Then extract the blood from your arm, the same way that we extract blood from when you have your physical. Then we use an FDA-approved centrifuge. We apply a special method to separate the platelet-rich plasma and add calcium chloride to activate the factors of growth of the body. The entire process takes between 10 to 15 minutes. It's done here in the office, and then we use a little fine needle and then inject platelet-rich plasma into the shaft and the head of the penis. This causes the growth factors in the plasma, which are the same curative factors that the body uses when there is a wound in the body, to start rejuvenating and healing the penis. This is a remarkable procedure. The procedure causes significant improvement of erectile dysfunction. It helps with ejaculatory disorders and other sexual function of men after surgery. It is my experience that when pshot is done properly by a trained and certified professional, the procedure can enhance satisfaction, it can enhance endurance, it can even improve the appearance, and can even increase the length and girth of the penis. What the pshot can do for you. Although each man's experience vary, most men has reported, number one, increased firmness of erection due to arterial tissue increase, blood flow and circulation, increased sensation and pleasure, improve and may resolve prostate discomfort, and improve urinary incontinence. Let me tell you, the pshot or pshot is a great procedure for men. It's safe and is useful for a variety of medical conditions such as Peyronie's disease, but it's also exceptional for men that want to enhance his sexual experience. I get asked often in my office how long pshot or pshot lasts, and the real answer is we just don't know yet. What a pshot or a pshot does is the rich platelet plasma do is bring the healing factor into the sexual orgasm and promote and enhance the healing response to new tissue that has been lost with age or chronic conditions, and create new vessels and new nerve ending. I tell my patients that maybe can last a year, but some of my patients have told me that the procedure can last from 1 to 1.5 years, and some of them still report good effect. How safe is the pshot? Well, I've been asked how young is too young to get the pshot, or how old is too old. The answer is there's no answer. Anybody, young, old, can have one because it's safe. It's the same blood of your body injected back to you. It has the same healing effect. Virtually, there's no side effect at all in this procedure. So if you're having ED or any sexual dysfunction, if you are older, if you're looking for sexual enhancement, or if you are younger, the pshot can be given at any age. I have been trained and certified by Dr. Charles Roner to administer this procedure, and I have been doing this procedure for the last 3 years with great success. So if you want to find out more about the procedure, just call my office and request a free consultation with me. Also, I can provide you with many solutions for any hormonal deficiency that you may have. Before I perform the procedure, I always evaluate the patient's sexual hormones efficiency to ensure that the procedure will be successful. I also can help you with your diabetes, your hypertension, and atherosclerosis. Before the procedure, I would like to help you with normalize those conditions prior to the treatment, so the treatment can be successful. So again, if you want to find out more about the procedure, you just call my office, request for a free consultation with me, and thank you, and I wish you peace and healthy life.